Good day, fellow learners. Once again, I'm your mentor Ray, and we're back. Welcome to my YouTube channel, Gapuz Mentors. For those of you who haven't subscribed yet, please do hit that subscribe button, and don't forget to hit the bell notification button so that you'll get notified whenever we upload a new video. So before we get to start and share with you some of the things that I know would arm you with the right frame of thought when you sit for your NCLEX test. So I'd like to ask you to join me in a mission. Our goal is actually to provide free NCLEX-RN application and review to 100 nurses this year. We've so far been doing well, referring most of our nurses who sought our assistance to sponsors that help them out achieve their great American dreams. So to help us achieve this, you can only you have to do a very, very minor thing. Just watch and finish the ads in our videos. And for doing that, I'm expressing my gratitude and saying thank you in advance. Okay, so just a reminder, if you have any requests for any future topics which you may want me to cover in my future videos, please do send me your questions through this email, mentor.raygapuz@gmail.com. Now, for today's lesson, we're going to talk about fentanyl, specifically the concepts or pointers for the NCLEX-RN, which I want you to remember. I've got to do, so I'm not crying. So, what a way to begin, but through my favorite, a functional concept, either a word, a sentence, or phrase that gives you a sense of direction as you try to deconstruct questions on the NCLEX-RN. So here's a functional concept. Fentanyl is a synthetic opioid in either transdermal patches, tablets, either sublingual or buccal tablets, in film, lozenges, and nasal spray. And it's used for treating severe pain, specifically in patients with advanced cancer, and also in children suffering from breakthrough pain. So let's talk about all these things. And I'd like to draw your attention in the manner by which this medication is actually given. So first, let's talk about what are the things that you need to remember about a transdermal patch. Okay, fentanyl in transdermal form. So always remember that when fentanyl is given through this method, so it usually stays in the area where you attach it for 72 hours or 3 days. And usually, the first dose begins to work within or after 24 hours. So in essence, it takes within 24 or after 24 hours before the patient could actually feel some therapeutic effects, okay? Now, what are the things that you have to tell your patient when they are getting fentanyl, okay, through a transdermal patch? First and foremost, okay, especially for caregivers and nurses as well, you do not touch, okay, the adhesive surface of the patch, as you can actually absorb it, okay? And if the patient is actually receiving the patch, okay, and they are trying to attach the patch themselves, okay, touching it could actually result to absorption of fentanyl, and that could potentially actually increase dosage of the drug. Now, so what is important, therefore, to tell caregivers of patients having fentanyl transdermal patches is the fact that they need to wear gloves. If they're not sure, if they can be careful about administering your fentanyl transdermal patches to the patient. Now, the first thing that you have to know is where is it usually attached, okay? Either on the chest, okay, the upper back, or the upper arm. But for children, it's best to place it on the upper back to decrease, okay, the risk of it being removed and potentially swallowed by children. You know how it goes. Sometimes because of their curiosity, they may think that this could taste something else, and that's not a safe thing for them to do, okay? So when you're looking for the best part where you could actually attach the patch, you have to make sure that the chosen area has little or no hair, okay, no scars, no injury, no cuts, no burns, no irritation, and not exposed to radiation. Now, it's also very important that if your patient is having your transdermal patches, you have to tell them to avoid excessive heat. So which means they should avoid going to the sauna or avoid using heating pads or avoid excessive sun exposure and even excessive exercise, okay? Now, how do we actually ensure that the patch is properly attached. So after we actually open it, we make sure that we attach it to the side, okay, using the palm of the hand, and we press on it for at least 30 seconds. If it becomes loose, we need to tape it, okay, with a first aid tape. Now, what about if it touches itself on its own? You do not reattach it. You just throw it away and then, okay, apply a new one. Okay. Now, if you accidentally touch the patch, what is important is you wash your hands with water. Okay. Do not use soap or any other cleansers. And that's the same thing that you have to know when you are fond of cleaning the site before touching it. You don't use cleansers or soap. Okay. Now, after 72 hours, usually the patch is removed. And it's very important that you have to follow your doctor's instruction. Now, when you're using another patch, you make sure that you have to use another body part if you are applying a new one. And make sure that you have an interval of at least 3 days before using the same body part that you used for the first patch. Okay? Now, what about if we talk about your buccal tablets? Okay, so what are the things that we have to tell our patient when they are receiving fentanyl in buccal tablet form? Okay, usually you have to remember that the brand name for the buccal tablet form of fentanyl is your Fentora. Okay, and all you have to tell the patient is to actually open the tablet and then place the tablet in the mouth, usually in the upper back teeth, okay, between the cheek and the gum, and to leave it in place for 15 to 25 minutes, and they have to wait for it to be dissolved. How would they know that it's dissolving? They would feel gentle bubbling sensation, okay, and that is expected. So we also ask the patient not to spit, not to chew, not to bite, or not to suck on the buccal tablet. Okay. Now, if after 30 minutes some are not dissolved, we ask the patient to swallow it and do so by drinking a glass of water. Now, if at any point in time within the administration of the buccal tablets, the patient would feel dizzy, sleepy, or nauseated, before the tablet dissolves, it's important that we tell our patient to rinse the mouth with water or spit the remaining tablet. Okay, that is very, very important for them to do. Okay, now, what about when our patient is using fentanyl sublingual tablets? What are the things that we have to tell them? First, okay, we have to tell them to moisten the mucosal lining of the mouth, and they can do that by actually sipping water, okay, and then either spit or swallow it. Okay, and then after doing so, they have to place the tablet under the tongue. If they're using more than one tablet, they make sure that they spread it around the floor of the mouth, under the tongue, and then leave it in place. We instruct the client not to suck, not to chew, not to swallow, and okay, we tell them not to eat or drink until the tablet is completely dissolved. So it's very, very important that they do not eat, once again, or drink until the tablet is completely dissolved. Okay? Now, what about if our patient is using fentanyl in the form of a film? Okay? Usually, the brand name is Abstral. Okay? Once again, we wet the area of placement in the mucosal lining of the mouth, usually in the cheeks, either in two ways. We use the tongue to wet it, or by rinsing the mouth with water. Okay? And then we hold the film with the pink side up, okay, using our dry fingers, and then we place the film in the mouth, okay, with the pink side against the cheek, where the area where we moisten, okay, and then we press on it for 5 seconds, and then we tell the patient that they would expect a minty flavor, okay, as the drug is dissolved in 15 to 30 minutes. Now, what do we tell our patient? Once again, do not chew or swallow the film, okay? Can they eat? They can eat after it dissolves. Can they drink? They can drink within 5 minutes after they have touched it. But they have to wait until all the film is dissolved before they eat, okay? So pay particular attention to the instructions because it's very, very important for us that we are precise as we educate our clients. Now, what about if our patient is taking fentanyl in lozenges form? Okay, usually the brand name for the lozenge form is actually your Actic, okay? Now, once again, we tell the patient to place the lozenge. It usually comes with a handle between the cheek and the gum, and then this time, we can tell the patient that they can suck on it. But we tell them not to chew, not to crush, or not to bite the lozenge, okay? Once again, while the lozenge is in the mouth, they're not supposed to eat or drink. And they have to wait 15 minutes for it to be dissolved. At any point in time, if they feel dizzy, very sleepy, or nauseated once again, even if it's not yet finished, they have to remove the lozenge and dispose it, okay? Now, make sure that when they discard the handle, it should be away from pets and it should be away from children, meaning the pets and the children should not be able to access this, okay? So it's very, very important that they discard the handles properly. Okay, now what about when our patient is taking fentanyl in nasal spray form? Okay, this is actually the nasal spray form is actually indicated for breakthrough pain, which simply is defined as episodes of pain that could be sudden and severe despite round-the-clock treatment with pain medications, okay? Now, when a patient's using your nasal spray, we actually have to tell them not to use it more than 4 times in a day. And if they still experience pain despite using the nasal spray for maximum 4 times, they have to refer to their physician because the physician may need to adjust the dosage of the medication. Now, what is important that we have to tell our patient is that they have to pay particular attention on the indicator of how much, okay, spray has been given to the patient, and they have to know where to locate it. So which simply means for each spray, they have to look at the counting window or the counter window of the spray. And for each spray, the counting window would usually increase by 1. However, it's very important that once the counting window has already the number 8 in it, okay, that simply means that they already need to discard the spray and never to use it anymore. And if it still contains some amount of liquid, they just have to spray it in the container and make sure, or flush it out and make sure that no pets and no children could access it. Okay, so to administer your fentanyl nasal spray, if the patient is actually having a runny nose, it's important to first instruct the client to blow their nose, and then we need to prime the bottle by spraying 4 sprays into the pouch. If we're using it for the first time, then we instruct the client to sit upright and insert 1/2 inch of the tip of the bottle or the nozzle into one nostril, and then close the other nostril with the finger and then press on the spray. Okay, so we make sure that we only use one nostril at a time. Now, what do we ask the patient after we spray? We ask the patient to breathe gently through the nose and out into the mouth once the spray has been given. And then we ask the client to maintain the sitting position for at least a minute. And after that, it's very important to tell the patient never to blow their nose for at least 30 minutes. So this is one important thing that you have to remember. If the patient has runny nose, they can blow their nose before you apply the nasal spray. But once the nasal spray has been administered, we instruct the client never to blow their noses for at least 30 minutes. Okay, so let's move on to some other important concepts on fentanyl. Let's summarize the important facts that I'd like you to remember on fentanyl. Remember, once again, it's a synthetic opioid. It's a narcotic analgesic used for the treatment of severe pain in clients with advanced cancer. That's a classification. How will you know that it's effective? There's pain relief. Exactly what time do we have to give it? We use it exactly as directed by the physician. We never actually increase the dose on our own. We need to refer to the physician. And then the common side effects would be drowsiness, stomach pain, or gas. You have dry mouth, chest pain, reddening of the face, neck, or upper chest, swelling of the hands, arms, feet, ankles, or lower legs. Okay, so it comes in different forms. So lozenges under the brand name Actic, sublingual tablet, Abstral, film, Onsolis, buccal tablet, Fentura, patch, Duragesic, and nasal spray, Lazanda. Okay, so what do we need to instruct our patient? Do not stop other pain medications when treatment with fentanyl is begun. So which means to say we could actually administer fentanyl in conjunction with other pain medications. Okay, so the doctor may tell you to use a second lozenge if you're using a lozenge, or tablet if you're using a tablet, if your pain is not relieved after a dose. So use the second lozenge, take 15 minutes after the first one. But when you're using a tablet, use the second tablet, Abstral or Fentura, 30 minutes after starting the first one. So which simply means the interval, if you're using a lozenge, should be 15 minutes between the first and the second dose. Whereas the interval, if you're using a tablet, would be 30 minutes between the first and the second dose. Okay, and then do not eat grapefruit or drink grapefruit juice. Pay particular attention to this concept while on this medication. Why? It could actually potentially alter the absorption of the drug. So remember to instruct the client not to eat grapefruit or drink grapefruit juice when they're on fentanyl. And K, keys to giving it safely. Okay, assess for signs of overdose like drowsiness, dizziness, confusion, shallow breathing, smaller or pinpoint pupils. That's a sign of opioid overdose. So it's very important you check on the pupils of the patient frequently. And then it may be habit forming with prolonged use, and each type of fentanyl is absorbed by the body in a different way. So do not substitute one product for other types. So these are the most important things that you have to remember about fentanyl, okay, represented by our check framework. Classification, how will you know that a medication is effective? Exactly what time they have to give it, client teaching tips, and keys to giving it safely. 5 important facts about fentanyl. Okay, now should we have another functional concept? Remember this: fentanyl is contraindicated in clients with known hypersensitivity reaction to the drug, those with bronchial asthma, as fentanyl could actually affect breathing, those who are comatose or with head injuries or brain tumor, as it has the potential to affect breathing, those using monoamine oxidase inhibitors, which is a form of antidepressant, or who receive it within 14 days. They have the potential to be experiencing hypertensive crisis. And then for those with myasthenia gravis, as remember, fentanyl may potentially worsen muscle weakness that is present in clients with myasthenia gravis. Okay? And of course, 2-year-olds or younger, and post-op interventions in the biliary tract. Okay, so that's very, very important. Okay, to note that these are the 7 common contraindications of fentanyl. Now, this is an important functional concept. Caregivers should wear gloves when handling the placement or removal of the patch on a client, either placement or removal. Pay particular attention, wear gloves. Okay, now wearing of gloves is also done by police authorities when they're actually trying to raid a place where there's a suspected use of fentanyl as a form of substance for use for being abused by a specific population group. Okay, so this is very important because the authorities could have fentanyl absorbed in their skin, so they also need to wear gloves when they're doing that, if they're actually trying to figure out whether fentanyl is being used by a specific population group suspected of using it. Okay, so once again, to recap on the application of fentanyl patch, we need to wash the hands, then remove the old patch, fold the sticky sides together and discard it in a trash bin, making sure it's not accessible to pets or children. Then open the new package and carefully take out the patch, making sure not to tear or cut it. And apply the patch as instructed, either to the chest, the upper outer arm, or the lower abdomen or hip. But for children, it's best that you apply it on the back to prevent them from removing it and playing with it. And then press along the edges, okay? If it detaches itself, you could actually reinforce it with a Band-Aid tape, okay? Or, a first aid tape. And then if it detaches on its own, all you have to do is to throw it off and then attach a new one. Remember, it has to stay in its place for 72 hours and then discard the packaging, okay? So these are the areas where fentanyl patch could actually be attached, either the upper chest, the upper outer arm, the lower abdomen, or the hip. So fentanyl is a safe option for clients on hemodialysis requiring long-acting opioids for pain control. So ketorolac. Now, ketorolac is actually a non-steroidal anti-inflammatory agent that is used to treat moderate to severe pain. Now, it should never be used more than 5 days. So in essence, it is used for short-term pain management. So ketorolac may decrease the excretion rate of fentanyl, which simply means the combination could actually result in a higher serum level of your fentanyl. So in essence, it allows fentanyl to exert its therapeutic effect longer. Okay? Ketorolac has significant analgesic properties without cardiovascular or respiratory depression. That's actually the advantage of ketorolac over fentanyl. So a mixture of fentanyl and ketorolac would be better than opioids alone. So it simply means that that is allowed. If ketorolac is co-administered with fentanyl, that's a better pain management strategy than just plain fentanyl or opioids alone. And then, intravenous administration of fentanyl may cause muscle rigidity, and reversal of it requires use of muscle relaxants. And when you say muscle relaxants, it could potentially worsen the muscle weakness in clients with myasthenia gravis. That's why it's not indicated, okay, that your patients with myasthenia gravis could be placed on fentanyl. But fentanyl could also be used for patient-controlled analgesia, okay? So, let's use what we've learned and try to answer a sample question. Here we go. A client who is being treated with fentanyl makes the following statements, which statement of the client needs follow-up. So the key phrase here is the phrase needs follow-up, which simply means that the patient could develop a potential complication related to the treatment and the planned intervention, or, okay, that this phrase simply means that the patient may not possess adequate knowledge of the repercussions or complications as it relates to the use of fentanyl. So let's analyze its option. One, I just had my hemodialysis 3 hours ago. Well, we said a while back in functional concept that fentanyl is a safe choice for clients undergoing hemodialysis. Two, I just took ketorolac 2 hours ago. What did we say? Fentanyl in a combination of combined with ketorolac is a better option than fentanyl alone. So no problem with that. Three, I usually go back to my doctor every 3 months to follow up on my medications for myasthenia gravis. Now, this is actually a concern, which simply means that the patient might be suffering from muscle weakness. Okay, if fentanyl is given, they develop muscle rigidity, and usually the muscle relaxant given to counteract that effect of fentanyl may potentially add on the muscle weakness that is caused by myasthenia gravis, thereby worsening muscle weakness and affecting respiration, okay, in a negative way. Okay, so 4, I cannot use fentanyl if I have bronchial asthma. So the best answer, therefore, is number 3. I usually go back to my doctor every 3 months to follow up my medication for myasthenia gravis. That needs follow-up from the nurse, because this indicates that the client may not have enough knowledge as it relates to the effect of fentanyl on the client's myasthenia gravis. Okay. So once again, it's shout out time. Congratulations to our online review NCLEX RN passer from Far Eastern University Nicanor Reyes Medical Foundation, Janina Gia Tolentino, USRN, who passed the New York Board of Nursing, okay, test, okay, that she took last October 21, 2020. A way to go. Congratulations to a nurse who never gives up and who never gave up. That American dream. Her being representative is Touch of Liberty, New York. And she took the test at a time when a lot of people are so challenged and so stressed brought about by the pandemic. Way to go, Janina. Congratulations. Okay. And we wish you well in the next phase of your nursing career. So this is Mentor Ray saying a functional concept a day keeps your NCLEX RN fears away. So if you love this video, please don't forget to subscribe and hit the like and bell buttons. So let's learn together. For more instructional videos, subscribe to my YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray. So this is actually Gapuz Mentors, okay? We do also tutorials and review as well as coaching. We do one-on-one coaching for all of these specific tests, okay? And you could actually choose among the videos that we have there. Like, for example, we have a video that just deals with pointers on EKG if you don't have adequate time. So it's just like 19 minutes and 30 seconds, so approximately 20 minutes. Or if you have time to spare and you may want to learn ECG interpretation for NCLEX, then I have a longer video that's 1 hour 38 minutes and 15 seconds, but it's very comprehensive. It integrates a lot of NCLEX concepts. So if you may want to get yourself exposed to NCLEX RN style questions, please don't hesitate to subscribe on our YouTube channel. Subscribe our YouTube channel, okay? So let's learn together. If you have any requests for future videos which you may want me to cover, please do send in your request to my email, mentor.raygapuz@gmail.com. Disclaimer, this instructional tool is created to enable students to develop their test-taking skills. The question or questions and answers contained in this instructional video were patterned after the official publicly accessed samples from the RN test plan of the National Council of State Boards of Nursing, or NCSBN. The discussions and rationale presented in the video are based on the lecturer's research and are meant to provide an explanation for the answer or answers to the question or questions that is or are presented. The lecturer makes no claim, directly implied or otherwise, that the rationale discussed is officially endorsed by NCSBN. So see you on my next video. Happy learning. This is Mentor Ray.